Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons drawn from real cases we see every day. Behind every symptom is a real story, and today's topic, complications of diabetes affecting the nerves and stomach, is something we encounter more often than many people realize. That's why our team is breaking it down from 4 key perspectives: what the doctor evaluates, what the nurse observes, what the pharmacist safeguards, and how the dietitian supports recovery. This is the pharmacist perspective. There's a pattern we often see in diabetes-related complications. It starts with small changes: burning or tingling in the feet, numbness that comes and goes, or a different set of symptoms: early fullness, bloating, nausea. At first, each symptom is treated on its own. Something for the nerves, something for the stomach, something for blood sugar, and gradually medications begin to accumulate. At that point, it is no longer just about symptoms. It is about how the medicines are interacting. Because diabetes does not affect one system, it affects nerves, digestion, blood vessels, and how drugs are absorbed and processed. So treatment must be coordinated. Now look at what is commonly used for delayed stomach emptying. Medications like metoclopramide may be prescribed. They help move food through the stomach, symptoms improve, eating becomes easier, but these medicines are not meant for long-term uncontrolled use. Over time, they may cause drowsiness, restlessness, abnormal body movements, especially when used continuously without review. At the same time, nerve symptoms are being treated: pain, burning, discomfort. Additional medications may be added. Then come the core treatments: blood sugar medications, blood pressure medications, each one necessary, each one working differently. But together, they require careful balance, because some combinations can increase sedation, affect blood pressure, change how medicines are absorbed, and in diabetes, even small shifts can have bigger effects. Now look at what often happens. One medicine is started, relief is partial, another is added, then another based on new symptoms, and gradually the medication list grows, without a full review of how everything fits together. Now the system becomes harder to control. Blood sugar fluctuates, dizziness appears, fatigue increases, and it becomes unclear: is this the condition or the medication effect? Not because treatment is wrong, but because it is not being coordinated. So the first step is clarity. Know what each medicine is for. Diabetes medications control blood sugar. Blood pressure medicines protect organs. They are not interchangeable, and they must be used with purpose. Then comes structure. Take medicines as prescribed. Avoid long-term use of certain drugs without review. Report side effects early. Do not start or stop medications on your own, because inconsistency creates instability in the whole system. Now step back. Nerves are affected. Digestion is slowed. Blood sugar is fluctuating. Medications are trying to stabilize each part. Everything is connected. When medications are well managed, the outcome improves: better symptom control, more stable blood sugar, fewer side effects, safer long-term care. Final point: diabetes care is not just about lowering sugar, it is about managing the whole system, including how medications work together. Because adding medicines without coordination can create new problems. So don't just take them, understand them, review them, use them safely. When to act: if you have diabetes and are experiencing nerve pain, stomach symptoms, or are taking multiple medications with new or unusual effects, do not ignore it. Speak to your pharmacist or healthcare provider for proper review, or call or WhatsApp +233 2087 20347. And remember to explore the other 3